Hi, everyone. It's hard to believe that this is our last week together. Time's gone by so quickly. So let's look what Module 6 or Week 6 has in store for us. We start with our devotion, as we do every week, and our overview of the information that's going to be covered in this week's lesson. Leaders are responsible for articulating a preferred future for our profession and its practitioners, whether they're in a clinical practice, administrative, educational, research, health policy, or other role. Therefore, those of us in the profession have to make a concerted effort to increase the visibility of nurses, enhance the image of the profession, work together in validating nurses' contributions in providing effective and efficient patient care, develop partnerships, network with all members of the healthcare team, and promote increased access to nurses for all people in need of health care. This is the final week, so I want you to take a moment and reflect on the material that you have read over the last 6 weeks and what kind of a leadership style do you have? You are about to embark on a profession that carries a great deal of responsibility. And I think when I began working as a nurse practitioner, um, things were a little bit different. I've been in practice now for about 10 years, and I find that many of my students really don't have any idea what a nurse practitioner is or what they do. Many different roles uh, as nurse practitioners. So, me, I work as a family nurse practitioner in an acute care setting. I'm not a primary care provider. The patients that come to see me typically are sick, and I see anywhere from 15 to upwards of 30 patients a day. My days are 10 hours long. I'm not gauged on time between patients. Um, However, our clinic closes at 7, and if there are 10 people waiting, I may not get out of there until 9. So I'm not a primary care provider. As I said, most of the patients who come to see me are sick. I also do lots of school physicals, sports physicals, things like that, work physicals. Um, but many other nurse practitioners work different roles. They may be primary care providers. They may work for specialists. I find that many specialists utilize nurse practitioners in their office. They see patients. They may make rounds in the hospital. Another function of nurse practitioners, maybe they work as a hospitalist in the hospital, work in elder care where they do home visits on the elderly. And oh gosh, there's just a whole bunch of different mechanisms and different methods. They may work in the fast track in the ER. I have one friend of mine who is a nurse practitioner at a big university hospital, and she actually is a trauma nurse practitioner. So lots of different roles out there. And part of the duty you have as being a nurse practitioner is to let other people know what it is that we do. I think that's one of the things that surprised me the most when I adopted this role 10 years ago was that many people who came to see me didn't know what nurse practitioners did. I think that it's becoming much more we're advertising what we do a little bit more, but so many patients would come in and say, "Are you a doctor? Are you a physician assistant?" And at first I would be like, "Oh, no, I'm not." I didn't say that, but I was thinking that in my head. Then I realized I needed to educate patients about our role, and that is part of what we have to do. And so now, any opportunity I have, I speak about what nurse practitioners do, and what our scope of practice is, and what makes us different from physician assistants. The big one is that we can practice independently. Physician assistants do not practice independently. They bill under the license of the physician. We bill independently. So that is a big thing that keeps us apart. Or, yes, the differences between the two roles. So as you move forward and begin um, the next step of your education, carry those things through, that you know what you do and you're about to become an incredible provider of care to others. And it's a huge responsibility. And you're going to be getting a lot of information in a short period of time. So you really must focus on your studies. And it's difficult for you. I realize most of you have families, you work, and now you're going to school. It's important that family always comes first, but you have really got to consider the importance of your nursing education right now. What you're going to be learning in these next weeks is going to be the basis of your practice, and you are going to have patients coming to you and asking for your judgment and treating them for illness. I like to tell nurses sometimes, some of my students, I can well remember when I was working as a bedside nurse, and nurses would stand around the nurses' station and they'd say, "Oh my gosh, why is he doing this? Why is he doing that?" Speaking to the provider, why is the physician doing it this way? He should be doing it that way. Well, now guess what? The shoe's on the other foot. You don't want to be the one that is now being said, "Why is she doing it that way?" or "Why is she doing this?" You want to make sure that the decisions that you make, you are utilizing through the knowledge you've gained through your education. So it needs to be way up there on your priority list. And so just keep those words of advice near to your heart over the next weeks as you begin to jump into your studies and the clinical portion of your training. Now let's look at our discussion this week. And I'm going to be getting your papers back to you within the next couple of days, hopefully. So let's look at this. With the constant flux of the socio-economic environment, you may be called upon to assist in the solution for healthcare problems. How will you affect change within your environment that you will mobilize your colleagues to embrace your vision to improve the healthcare in society? So that's a big one. So I'm going to be spending extra time reading through these. And then don't forget, you need to post on your colleagues' uh, discussion forum. So I look forward to reading your posts and have a great week.